Good afternoon, everyone. I'm Charlotte Hespe, the Chair of EIS Health, the company that's inherited SESML's 2 Headspace sites, ESML and SESML's PIR sites, SESML's 2 after-hours co-ops, and last but not least is auspicing the Central and Eastern Sydney PHN. I apologise for the quality for this video, but I'm doing it single-handed on my iPad and I'm doing the best I can, so thank you for being tolerant. I have already met many of you, but not all of you. While I have you all here, I wanted to start by thanking all of you for joining us on this exciting venture. I like Michael's John Scar quote, which is basically saying, we make the future, and how we do it changes us as well. And I want this to be a great place to work for all of us, where we'll work together with our partners to do great things. So what are our future directions? The future for health is patient-centred care. And to do that properly, to improve our community's health outcomes and address their health needs, we need to support all our primary care practitioners to change with the times and embrace patient-centred care. What of commissioning, I hear you ask? Much of the rationale for moving from MLs to PHNs was the view that PHNs would have a much greater role in commissioning services at a local level. EIS Health already commissions most of our ATAP services and most of our PRR services. Inner West Sydney Medicare Local used to commission speech pathology services and community nursing services to address specific needs. Right now, Michael and Andrew Coe are working on a commissioning framework for after-hours services that will serve as a template for any expansion in our commissioning role. So we do have organisational expertise in this area already. And when the time comes, we'll be ready to expand our role. But the commissioning space is still evolving. The Commonwealth's view is that we should use the commissioning process to address health needs. However, it's not fair to say that compared to our rural colleagues, we do not have major gaps in health service provision. Gaps exist, which our upcoming needs assessment process will further elucidate. And when Commonwealth funding becomes available, we will be ready to move into that space. Word from the Commonwealth is that additional funding may be available to PHNs to commission additional health services, maybe next financial year, but full details are not yet available. In the Horvath review, it was proposed that PHNs would locally commission programs that are currently commissioned out of Canberra. This might include Commonwealth-funded mental health NGO programs and Commonwealth-funded aged and disability service programs, but again, full details are not yet available. So, in the meantime, the PHN sticks to its knitting, fomenting change, accelerating the diffusion of innovation, addressing national health priorities, enhancing and evolving primary care towards patient-centred care using quality improvement theory and methodology to assist implementation of sustainable change. So, what is the future for patient-centred care? Patient-centred care means better health promotion, better prevention, better early intervention, better chronic disease management, better health literacy, and better partnerships with their health providers for people in our community. It means understanding and assisting primary care practices adopting models of patient-centred medical home, continuous, comprehensive, patient-centred, accessible, coordinated, and accountable practices. Our general practices must be on board with the concept of patient-centred care. Our GPs and their practice staff need our help to adopt the new technologies and the new systems that enable efficient and effective patient-centred care. Electronic medical records, the National My Health Record System, recall remind systems, best practice care planning systems, e-communication systems, use of apps and online systems that allow our practices to be good partners with their patients, their carers, and the rest of the healthcare team. Our role is to accelerate the diffusion of these innovations through general practice and indeed through the rest of the primary care sector. A culture of quality improvement will be needed throughout the PHN and actively adopted by the board, the executive team, and staff members. As we work with practices and GPs to assist them in reviewing what they're doing and working toward achieving change. We will continue to welcome our allied health partners in from the cold, and we'll continue to move towards giving them the same support that we've been giving our general practice colleagues for the past 2 decades. Medicare Locals made a great start, and we'll continue to build on that momentum. We'll also continue to work with our health and intersectoral colleagues, local health districts, aged care providers, mental health providers, our universities, our public, private and not-for-profit partners who help us create a healthier future for our community. We will build on the momentum already built up by our predecessor MLs. I could say more, but suffice to say, these are exciting times, and I'm looking forward to us all working together to achieve great things, improving health outcomes and addressing health needs. Thanks for your attention, and I hope that you have a really great afternoon, and I look forward to hearing the outcomes of the day. Thank you.